Alright team, listen up. The patient presents with inclusion body myositis, lymphadenopathy, and surfer's ear.
Could it be dermatomyositis?
I'm leaning towards lymphoma.
I'm thinking it might be exostosis.
I suspect it's inflammatory myopathy.
No, and no. It's confluent and reticulated papillomatosis, you dimwits. We need to perform fat removal procedures immediately.
But sir, that procedure is risky and could endanger the patient's life.
I don't give a damn. It's the only way to save this patient. Now move your asses and get it done. Tracy, I need to talk to you about my patient with confluent and reticulated papillomatosis. I believe we should proceed with fat removal procedures to help alleviate their symptoms.
Hawks, are you sure about this? Fat removal might not be the best course of action for this particular condition.
I've been practicing medicine for years, Tracy. I know what I'm doing. Trust me on this.
Hawks, you have a track record of being wrong in these kinds of situations. I can't just blindly follow your recommendations without questioning them.
How dare you question my expertise, Tracy? I have successfully treated numerous patients with similar conditions in the past. You can't just dismiss my years of experience like that.
Leslie, we have a problem. The patient is in critical condition.
Oh no, what happened?
It seems that the fat removal procedures were not the correct treatment for confluent and reticulated papillomatosis. It's a serious situation.
We need to focus on the patient right now, not on how to tell Hawks. We have to do everything we can to save their life.
You're right. The patient's well-being comes first. Let's get to work and find a solution.
What the hell were you thinking? You nearly killed the patient with your incompetence? Wrong fat removal procedure. Wrong damn diagnosis.
I swear we thought it was the best course of action at the time, Dr. Hawks.
I don't understand how we missed it. It seemed like a straightforward case.
Maybe we should have consulted each other before making a decision.
I take full responsibility for my part in this mistake.
You're all a bunch of imbeciles. I can't believe I trusted you with this patient. No, debate all you want. I'm out of here. So, Johnson, how's the new puppy of yours doing? I remember you were so excited to bring him home.
Oh, he's doing great. Definitely keeping me on my toes, though. But hey, it's a nice change of pace from the chaos here at the hospital.
I can imagine. Speaking of chaos, I've been trying to crack this case for days now. The symptoms just don't add up.
Wow, you never stop thinking about work, do you? You need to unwind a bit, Hawks.
Actually, I think I've got it. It all clicks now. Thanks for the unintentional assistance, Johnson.
Wait, you're leaving just like that. What about our lunch?
Sorry, Johnson. Duty calls. I'll catch up with you later. I have a new diagnosis for the patient. Metachromatic leukodystrophy.
What? Are you serious, Hawks? You can't just storm in here without proper protective gear.
That's completely unprofessional, Hawks. We have protocols for a reason.
Yeah, you're endangering not just yourself, but everyone in this room.
Hawks, you need to follow the rules like the rest of us. It's for everyone's safety.
Listen, I understand your concerns, but I was right about confluent and reticulated papillomatosis. And now, the prognosis for metachromatic leukodystrophy is not good. It's a progressive disorder with no cure, leading to a decreased quality of life.
That's incredibly unfortunate. We need to make sure the family understands the gravity of this situation.
We'll have to have a difficult conversation with them, but it's crucial they're informed.
Let's gather all the necessary information and prepare to sit down with the family as soon as possible.
Tracy, I finally tracked down the correct diagnosis for the patient.
That's great news, Hawks. Well done on finding the right answer.
This whole mess wouldn't have happened if I didn't have such incompetent doctors to deal with.
Hold on. What do you mean by that? You were the one who initially gave the wrong diagnosis.
Well, my team's diagnostics could use some improvement.
Hawks! You can't blame others when you're the one responsible for the wrong diagnosis.
Stands up abruptly. I've had enough of this. Goodbye, Tracy.